Hi, I'm Scott Willis, National President of the APA. I stand here on the land of the Palawa people and overlooking the Port of Burnie on the northwest coast of Tasmania. I want to share with you an update of advocacy and policy engagements that we've done over the last few months. The COVID-19 pandemic and rollout of vaccinations is quite rightly the major health issue we're all currently facing, and the APA have continued on with our political drive and engagements. With most of the country either in lockdown or with restrictions in place, the APA has been advocating vigorously for national consistency for physios to provide essential services to the consumer. We have the support of the federal government, the RACGP, the AMA and all the others. Most states are still restricting physiotherapists providing our important delivery of services to most vulnerable Australians. The APA is fully supportive of reasonable lockdown measures to limit the spread of COVID-19, but we will continue to use the media, social media and engagements to push our consistent message that physiotherapy is an essential service and that it should be left to the clinician to make the judgment call on service delivery. I had a very successful meeting with Omar Khorshid, President of the Australian Medical Association, just a few weeks ago. Dr. Khorshid agreed that essential health service must be maintained during a pandemic. And he seemed very much on board with our request for the critical and essential physio treatments to be allowed. We also broached and discussed the first contact physio, and I must admit it was pleasing to talk to an orthopaedic surgeon who works with physios in his practice and is fully aware of the benefits and issues with having a pilot scheme trialled here in Australia. So watch this space on that one. The AMA are also planning to host a health funding summit when COVID-19 restrictions have eased and have invited me to participate in this, which I have accepted. The AMA really seemed open and collaborative across a wide range of issues, and I look forward to working with Dr. Khorshid over the coming years. I've also met with Minister Hunt just a few weeks ago, and it was very productive, where he conceded that we had demonstrated the economic value of physiotherapy. And what is our long-term vision and pathway to that? We are in the process of developing this piece and will present it back to him in the near future. We're also in the process of gaining a meeting with Minister Hunt to discuss our joint letter with for the four largest providers of allied health in aged care to discuss the lack of detail in the new funding instrument for aged care. This is on the back of significant engagements and partnerships with other stakeholders in aged care. So again, stay tuned for further developments. I've also met with Senator Jackie Lambie regarding the poor DVA reform of restricting veterans' access to same-day treatments of differing professions, just such as EPs and physio. We will take this to the Senate Select Committee, and that's in the next few weeks. I've also secured a meeting with the Shadow Minister for Veteran Affairs, Shane Newman, to ascertain the opposition position on this important issue for veterans. I've also met with the Black Dog Institute to discuss mental health and the role physios play within the mental health system. We discussed how physios can really be properly included as part of the integrated collaborative care, but also how we can provide better mental health care for physios, especially in this midst of this crazy world that we're living in. My Select Committee on Mental Health and Suicide Inquiry presentation really emphasised that the APA members are qualified, ARPA registered and trained to work with people who have mental illness. Physiotherapists are highly trained in multidisciplinary, interdisciplinary care. However, our mental health system limits this by not investing in and promoting team-based care that includes physiotherapists, and that we cannot separate mental and physical health. They intersect each other. So in summary, an incredibly productive couple of months despite the barriers of COVID-19. It's important to remind ourselves that we are in the midst of a global health crisis and that we need to pay attention to our own personal physical and mental health. So take care and stay safe.